Welcome to this explainer. Look, today we're going to replace all that internet anxiety you've been feeling about creatine with some calm, evidence-based reassurance. This whole breakdown was prepared by Dr. Thomas Hocker. He's a Harvard and Mayo Clinic-trained, triple board-certified dermatologist, Mohs surgeon, and dermatopathologist. Now, I'm not Dr. Hocker myself. I'll just be your narrator today, walking you through his clinical research. And you should know everything we're about to cover has been rigorously reviewed for up-to-date accuracy as of July 3, 2026.
We've all been there, right? It's a super relatable fear. You finally decide to start taking a simple, boring white powder to get a little more out of your workouts. But then, almost overnight, social media algorithms flood your feed with these intense warnings. Suddenly, you're convinced it's this dangerous chemical that's going to leave you bald and scheduling emergency kidney tests. What was supposed to be a healthy choice just feels, well, terrifying.
So, here is our roadmap to clear this up. We're covering 1. The internet's creatine problem, 2. What actually works, 3. The hair loss rumor, 4. The kidney lab trap, 5. Brain boost or hype, and finally, 6. The simple creatine checklist.
Real quick, before we dive into the good stuff, this explainer is strictly for general education. It is not personal medical advice, and watching this definitely doesn't establish a doctor-patient relationship. Always talk to your own clinician before you make any medical decisions. Okay, let's get into it.
Section 1. The Internet's Creatine Problem. The truth is, creatine has this massive PR problem online just because it's completely misunderstood. It's actually a natural substance. Your body is already making about 1 to 2 grams of it every single day, mostly in your liver and kidneys. Its main job is to help recycle ATP energy when your muscles are doing short, intense bursts of effort. When you're looking at the supplement aisle, the only form that really matters is creatine monohydrate. In a fitness industry that's absolutely packed with dangerous extremes and wild claims, creatine is boring, but it's boring in the absolute best way possible. It's not a steroid, it's not a stimulant, it's literally the most studied sports supplement in human history. Taking it is just topping off a tank your body already has. It's like adding a little extra fuel to a gas can that's already sitting there half full.
Section 2. What actually works?
So what does the rock-solid evidence actually show? Well, this boring supplement reliably acts as a training amplifier. A massive meta-analysis of over 140 trials shows it significantly boosts your strength. We're talking an average of 8% greater strength gains than training alone. It builds lean body mass, and it noticeably improves high-intensity sprint and power performance. And here's the coolest part. It's not just for 20-something bodybuilders. In older adults, it preserves critical strength metrics, like leg press gains, which translates directly to keeping your independence and daily function as you age.
But we need a quick reality check here. The most crucial takeaway is this tiny number, 0.03 kilograms. That is the microscopic amount of muscle you will build with creatine if you do not exercise. See, it's not a magic couch pill. It won't melt fat independently, and it definitely won't build your biceps while you binge watch TV. It is a strict amplifier of hard work. The effort has to come from you first.
Section 3. The hair loss rumor. Let's tackle the most viral rumor out there, which is especially relevant for Dr. Hocker's dermatology patients. Will creatine make you go bald? Well, this entire panic stems from literally one single study from 2009 involving 20 male rugby players. That study showed a temporary bump in a hormone called DHT, which is linked to male pattern hair loss. But wait for it. That study never even measured hair loss. They didn't measure hair density, hairline recession, or any scalp outcome at all. Plus, that DHT bump has never been replicated, despite hundreds of subsequent creatine trials. The International Society of Sports Nutrition explicitly calls the idea that creatine causes hair loss a straight-up misconception. Now, if you're genetically prone to hair loss, sure, bring it up with your doc. But there is absolutely zero direct evidence that creatine causes baldness.
Section 4. The kidney lab trap. Next up is the kidney myth. You'll hear people loudly proclaim that creatine destroys your kidneys, but the reality? It's just a metabolic trick. Look, creatine safely breaks down in your body into a waste product called creatinine. Since doctors used your creatinine levels to estimate how well your kidneys are filtering, taking a creatine supplement can slightly elevate those numbers on a blood test. But this is just a harmless lab artifact. There's simply more raw material breaking down. It doesn't mean your kidney filter is actually broken. For healthy people using standard doses, 3 separate meta-analyses have completely confirmed that creatine does not impair kidney function.
That being said, context is everything in medicine. While it's super safe for healthy folks, there are certain groups who absolutely need to consult a clinician first. Why? Simply because the margin for guessing is much smaller. If you have pre-existing kidney disease, diabetes, high blood pressure, or if you take medications that affect your kidneys, you need medical guidance first. Oh, and the American Academy of Pediatrics advises against creatine use for teens under 18 without professional oversight. It's not that creatine is inherently toxic to these groups, but rather that high-dose supplementation just hasn't been adequately studied in these more complex medical scenarios. Better safe than sorry.
Section 5. Brain boost or hype?
Let's pivot away from the fears and talk about the latest social media obsession, creatine as a miracle brain pill. We've got to call out the hype here. The European Food Safety Authority flat out rejected the claim that creatine is a proven cognitive booster for healthy young adults. Calling it a universal brain supplement? Yeah, that's just not supported by the evidence right now. And while we're at it, those expensive, fancy forms you see, like creatine HCl, ethyl ester, or liquid creatine, it's all just marketing noise. None of them have been proven to work any better than cheap, plain creatine monohydrate.
Let's ground all this hype in clinical reality. As you can see, the muscle and strength benefits are incredible, backed by hundreds of high-quality randomized trials. The brain benefits, though, the evidence is low to moderate. It's interesting, but it's very early days. Creatine mostly shows cognitive promise only when the brain is under severe metabolic stress, like in older adults or folks dealing with sleep deprivation or oxygen deprivation. The research on depression is also very low quality at the moment. It's a really promising direction, but entirely unproven as an actual treatment.
Section 6. The simple creatine checklist. So how do we cut through all the noise and actually use this supplement correctly? Here's Dr. Hocker's simple, evidence-based plan. First, choose creatine monohydrate and only monohydrate. Second, take it consistently every single day. Timing matters way less than just remembering to take it. Third, pair it with resistance training or you won't see the benefits. Fourth, tell your clinician you're taking it before you get routine kidney labs so they aren't surprised by a slightly elevated creatinine level. And finally, look for third-party testing on the label, like NSF or Informed Sport, so you know exactly what you're putting into your body.
And when it comes to dosage, just remember this: 3 to 5. 3 to 5 grams a day is the completely boring, standard maintenance dose you need. Actually, this proves you can entirely skip those uncomfortable, aggressive loading phases that supplement companies are always pushing. A slow, steady, daily dose of 3 to 5 grams will saturate your muscles perfectly fine over a few weeks, and it'll save you from the stomach discomfort.
We're going to leave you with this final empowering thought to keep in mind the next time the internet tries to scare you or sell you a miracle. Creatine is not a shortcut. It is simply a small amplifier of good training, good nutrition, and good medical judgment. It is boring in the absolute best way possible. So the real question is, are you ready to tune out the internet noise and just get back to the basics of hard work?